I'd like to welcome Bob Blancato, president of Matz, Blancato and Associates, an expert and long-term advocate for older adults and the aging community, who will be speaking with Andrew MacPherson, founder of the Coalition to End Social Isolation and Loneliness, on the progress being made on a bipartisan basis on Capitol Hill in Washington, D.C. to address this national crisis. Andrew, turning it over to you.
Excellent. Thank you so much, Eddie. And I'm truly honored to introduce Bob Blancato, who is a true legend in healthcare policy and especially aging issues here in Washington, D.C. As Eddie said, Bob is the president of Matz, Blancato and Associates. In that capacity, he also serves as the national coordinator of the bipartisan, over 3,000 member Elder Justice Coalition, the executive director of the National Association of Nutrition and Aging Services Programs, and the national coordinator of the Defeat Malnutrition Today Coalition. Bob has long been recognized as a national advocate with policy expertise on behalf of older adults. Just recently, in 2019, he was invited by both the Senate Finance Committee and the House Ways and Means Committee to testify on a range of issues related to aging policy in America. Bob's prior work history includes 17 years as a staffer in Congress and an appointment by President Clinton to be the executive director of the 1995 White House Conference on Aging, one of 4 he has participated in over the past 2 decades. He's a member, as a volunteer, he currently serves on the national board of AARP and the board of the National Hispanic Council on Aging. In 2019, Bob began a 4-year term on the National Advisory Committee on Rural Health and Human Services, appointed by then Secretary of HHS, Azar. Bob holds degrees from Georgetown and American universities and has won numerous awards for advocacy, most recently the American Society for Aging's ASA Hall of Fame Award in March of 2020. But I think maybe most importantly, Bob was instrumental in the development and the launch of our coalition, the Coalition to End Social Isolation and Loneliness, and we are truly thankful for his leadership and support. So Bob, my friend, welcome, and I'll turn it over to you for opening remarks.
Thank you very much, Andrew. Very nice introduction. I appreciate it. Eddie, thank you for the introduction as well. I'm honored to be part of this action forum on social isolation and loneliness of the Coalition to End Social Isolation and Loneliness. What a great turnout you have. That shows you how important this issue is. And Andrew, I'm going to come back at you. My congratulations to you for your 3rd year of directing this coalition. And congratulations to all of those who have done work on behalf of this coalition. You were always about raising awareness and advocating for federal policy to address these 2 issues. But what you did not foresee when the coalition was started was the pandemic. No one did. No one had a playbook for the pandemic. A pandemic which sadly continues and has exacerbated the issues of social isolation and loneliness to a whole new level. Before the pandemic, we were dealing with a growing national concern. Today, we're looking at a full-fledged public health emergency. So it's hard not to notice, though, how much new interest and action has occurred around these topics because of your work with the coalition. Another thing the coalition has done effectively in its advocacy and policy work is to recognize the linkage issues related to social isolation and loneliness, particularly for older adults, which is my focus. The linkage between social isolation as a social determinant of health. We can now link social isolation and loneliness to one particular growing form of elder abuse, self-neglect. Social isolation and loneliness to falls, to malnutrition, to mental health, with anxiety and depression being such outgrowths. And of course, social isolation and loneliness is an equity issue. From a great article by Carrie Henning-Smith, issues such as housing, inadequate segregated housing, inaccessible transportation which hinders more social opportunities, the digital divide and how it hinders social connectedness, whether it's through simple reassurance, wellness checks to telehealth, and of course, issues of poverty and inadequate income and how that contributes to social isolation and loneliness. The Commonwealth Fund states that 40% of high-need isolated older adults have incomes below $15,000 a year. But since the theme today is action, let's look at what's been done, what's expected to be done, and what might be done coming up. And then we'll close about what needs to be done overall. And a lot of it is tied to your agenda, of course. What has been done, Senator Smith and Congressman Sanchez touched on it, the 2020 Older Americans Act reauthorization and its language calling for first-time screening for social isolation and planning by ACL to address social isolation. And this idea, by the way, came from a rural area agency on aging director who said, why don't we have it? Sometimes it's as simple as that, right, Andrew? Just say something and let it be done. Now, a side note about the Older Americans Act, one clear impact of the pandemic was on the Older Americans Act nutrition program. Prior to the pandemic, 2/3 of older adults were getting their meals in a congregate setting. Through most of the pandemic, 95% are now getting it through home delivered meals. The congregate nutrition program has, as one of its most important features, the opportunity for socialization. And our research that we've done in our group has proven this. 90% of older adults we surveyed said that the reason they go to those programs is for socialization. We need to all work to get these programs reopened as quickly as possible. The pending Elder Justice Reauthorization and Modernization Act, which is in the Build Back Better bill that we've talked about, I'm sure, before. It was built off two concerns: growing victimization of older adults living alone and COVID scams that they were being victimized by. The bill, as it is in the House at the moment, would provide a $4 billion infrastructure for elder justice, including $250 million for social isolation programming grants, which will be awarded to area agencies on aging and other community-based organizations to conduct outreach to individuals at risk for social isolation or loneliness, develop community-based interventions to mitigate social isolation, and connect at-risk individuals with social and clinical supports. Also, HHS under this bill must establish programs to provide and improve training for area agencies and other community-based groups to address and prevent social isolation. And I want to add that your coalition and our Elder Justice Coalition together work hand in hand to make this happen. And I want to thank you for the work that you did on this. You know, there's a lot of possibilities depending on the fate of the BIF and the BBB on other social isolation issues. On the infrastructure bill, the broadband pieces, which would connect older adults to family, friends, and behavioral health supports, just to name a few. That's important in that bill. Once passed, though, localities are going to have a lot to say on how these funds are spent. Advocates need to weigh in now to get the bill passed, but they need to also weigh in when the money flows down to localities to make sure we have things like more accessible transportation so people can have community supports. On the Build Back Better Act, there's so many provisions. We'll probably touch on them in our dialogue later. But perhaps the most important is the investment in home and community-based services as called for initially by President Biden at $400 billion. Now in the House bill, it's $190 billion. The discussions are going back and forth. But this is what we want to focus on. This funding can make a difference in combating isolation. If you have 820,000 people on a waiting list, think about how many of them are socially isolated as a result of that waiting list. And if you have a provision that's going to add 500,000 new jobs in that space, you are doing a tremendous amount to help older adults in that space. We also in the BBB have the Elder Justice piece, the Older Americans Act funding for accessible senior centers and other infrastructure upgrades to get people back into the community setting. We also have a increase in supply of affordable and supportive housing nationwide, a $9 billion housing investment fund to increase investments in housing. And of course, we have in the House bill expanded Medicare benefits, poor oral health, dental, vision, and hearing. Every one of these conditions can contribute to social isolation and loneliness, especially poor oral health. Now, beyond these, we have other bills that have been out there that have been introduced to address social determinants of health for older adults, including benefits through Medicare Advantage and Medicaid. But I also want to mention that, as you probably have already, we have a wonderful new social determinants of health caucus started this summer by Congresswoman Bustos, Congressman Cole, Congressman Butterfield, and Congressman Mullen, to explore opportunities to improve the impact of services delivered to address social determinants that are supported by federal funding, and to amplify evidence-based approaches and emphasize collaboration across committees. So I want to close with just, since we're doing an action thing here, immediate action steps, we need to pass BIF and BBB. As big as possible, we can do it. Okay, the debt ceiling agreement, which may, I'll cross my fingers, get done today, provides the opportunity to get these bills done quicker, okay, which I think could happen. These bills are moving, unfortunately, in a downward direction on some of the funding things, but as a total shrink, we have to work to preserve as much of our priorities as possible, especially the home and community-based funding, and anything in the area of social isolation with elder justice that I mentioned before. And then finally, in terms of advocacy, a couple of points that I would want to make. One is, be at every table where issues and solutions related to social isolation and loneliness are discussed, whether it's Congress, the administration, state, or local. Get more incorporated into the cross-cutting equity issues of the Biden administration in your space. Look far and wide for best practices already going on in communities to address this issue. Keep raising awareness while keeping the issue as it is, an intensely personal, intensely local issue. Build alliances on the linkage issues and who is working on those issues. And finally, empower this coalition with your continued support and find them some new members and treat this as a coalition where everybody has skin in the game. Thanks very much.
That's terrific. And as I sit here and our audience sits here and listens to just the range and number of different policy opportunities that we have as a community and as a country, it's pretty incredible where we are today, and the opportunity is ours to take advantage of. So thank you so much for those remarks. A couple of questions from my end. We heard from Dr. Ye, and you just mentioned the issue of hearing devices and the challenge of not having proper Medicare reimbursement today for devices and for people who are challenged with hearing. Can you do some handicapping for us? What are the chances that we're going to see a benefit in Medicare move forward in this broader reconciliation package that you referenced?
Yeah. That's a difficult question right now, because as the bill overall size shrinks, you start to think about what's going to go versus what's going to stay. Yeah. And you've got three benefits being considered: hearing, vision, dental. Okay, I hate to say it. It sounds crass, but we're in Washington, so I guess I can get away with it. Who's got the best political muscle? Yeah. Because interestingly enough, as you may have seen, the American Dental Association is pushing back on the dental benefit. Okay, and that's why it got pushed back to 2028 for its implementation, at least on the House side. Yeah. But I'm guessing that a voice like your coalition raising the issue from that vantage point on the hearing side could actually be could tip the scales a little bit. Yep. Because sometimes you need to get people from the outside who have a connection, but were not necessarily involved in the beginning, raising their voice at the pivotal time. And so it seems to me that when Ways and Means Committee, which has done their work, but the Finance Committee has not finished their work, some pressure should be put on them to preserve those three benefits, because again, they all connect to social isolation in different forms. And the other part that I think is important too is that Medicare Advantage, as you know, has been doing some of this. And not everybody's in Medicare Advantage. It's time for a little parity with Medicare fee for service, and hopefully that can happen as a result of this bill.
I think that's absolutely right. I think we've seen an extraordinary amount of innovation occurring with the new flexibilities that are available in Medicare Advantage supplemental benefits. Right. And Humana is one of the leading members who we heard from earlier today of the coalition, and many other health plans are really innovating and providing those benefits. And if hearing and dental and vision became a part of the original Medicare benefit, it would create more space for benefits, I think, in Medicare Advantage that relate directly to social isolation illness. I think that's a really important point. But let's cut the baloney here a little bit. You talked about a number of ideas, and they're all, I think, really exciting to all of our audience members and participants today. What's actually going to happen? Let's talk. You want to talk about action? Where should we be putting our resources? What are the top three issues you think that actually we could get across the finish line this year to get the resources we need for people who are isolated and lonely across the country, and not just those who are older, but all Americans? Correct.
Okay, let me start on the executive branch side. Okay, monitor the implementation of the social isolation screening language in ACL, Administration for Community Living. Make sure they do it right. Make sure you have input. Make sure they understand the issue from your perspective. Okay, because you understand the importance of screening. I also think that something just popped on my screen here. On the immediate side, the Build Back Better Act. I mean, name your provisions that you think are important, and make sure we come out with the strongest possible bill. I believe, for example, the $4 billion in elder justice, since both Chairman Neal and Chairman Wyden introduced bills to accomplish the same thing, and they deserve tremendous credit for what they've done in this area. Having them both on board theoretically makes it possible. And sometimes in the world of 3 trillions and 2 trillions and stuff, $4 billion isn't a whole lot of money. But you have to explain what's an investment versus an expenditure. And pretty much everything we've talked about today is an investment in somebody's improved, better life, lowering healthcare costs and the rest. So again, push the BBB as hard as you can on home community-based care, elder justice, implementation of the social isolation screening language. And of course, there's some other things in the Older Americans Act, in the Build Back Better Act too. But I think the HCBS and elder justice are the most important immediate work to do.
Terrific. Bob, you've been a leader in national health policy issues for several decades now, and you're truly one of the best of the best that's in Washington. As you reflect on your many years in healthcare policy and in politics in Washington, have you seen an issue that this quickly gained steam and gained attention and gained potential for action? I mean, we were able to, as a community, because thanks to bipartisan champions on Capitol Hill, actually get language into the Older Americans Act and have it signed into law. We now, thanks to your leadership and the leadership of the Elder Justice Coalition, we've got language, bipartisan, bicameral, that's moving through both houses of Congress. I'm very optimistic about the future. Are you?
I am. And going to your first part of your question, I think the very fact that you formed a coalition was the right thing to do. Okay, because unless you dedicate resources and time and effort to a specific issue, it gets lost in the shuffle. Okay, people need to know there's something they can turn to, a resource they can turn to if they want to become champions as members of Congress. And that's one thing that your coalition's done very well. And I've learned this from my work with the Elder Justice Coalition. We had a senator call me and say, look, we care about the Elder Justice Act, but we need a dedicated coalition to get it over the finish line. Same thing here. Only difference here is that you've got several opportunities in the legislative arena to do things, and also funding. The year-to-year funding situation, I think, is important to go forward. But I also think that and I'll take a selfish plug of AARP since I'm on their board. I mean, their foundation's done tremendous work in raising the profile of this issue. But at the end of the day, think about this, and Andrew, you know as well as anybody, issues that have a grassroots foundation, if you will, where they are really local in nature, very personal and local in nature, have a tendency to rise to the national level because people will tell stories, people will make situations come about, and that automatically changes. Anytime you can localize and humanize an issue, you're always going to do better in the policy world. And you've done a great job, and your coalition has done a great job in that area.
My final question for you, Bob, thank you. And this is just really appreciate this time together and our audience hearing from you. Grassroots has come up multiple times in our discussion today so far. What's your advice to everybody listening today and everybody participating? They've already taken one important step, which is join us today and hear from all the national and global leaders that we've had as part of this conference. But it's named Action Forum for a reason, which is we want to get some work done here together. What is your specific advice for people listening today across the country and across the globe for interacting with policymakers? How can we engage everyone here and beyond to get these issues done? What's your advice?
Well, my advice is they need to make the local connection with their member of Congress and as early as possible, okay? And they need to do it in such a way where they start the process early, okay? I mean, first of all, there's so many new members of Congress getting elected every 2 years. They are wonderful training grounds, if you will, for advocates. Get them educated early and have them on board early, okay? Also, connect it locally, okay? When we do advocacy on elder justice, there are sadly cases every day in the news about elder abuse cases. When we go advocate on the Hill, we bring fact sheets up, and one of the sheets always has a news clip article from that district or that state that talks about the issue. Suddenly, it's a local issue. You can do the same thing. There's data out there about how much social isolation has increased in given areas around the country. Have that data available. Build those relationships, and also track where your member of Congress is in a public setting. And there's a new link called Town Hall Project, something or other. We'll find it to you, that you can go on and see where your member of Congress is going to be, and show up at a Rotary lunch and pop a question out, okay? Or just have a conversation. And sometimes when they hear it come from home, they're going to start looking. What are we doing on this space? What are we doing in this issue? And I think a lot of that could be done. And anybody who takes the time to join this Action Forum must want to do something. So here's your chance to do something. And we encourage you strongly to do that.
Excellent. Well, Bob Blancato, can't thank you enough for joining us today, but most especially for your leadership and for your allyship in this effort. It's going to take all of us, but especially national leaders like you, to help move this issue forward. So thank you for joining us. And
my pleasure. Thank you. Thank you for having me. All the best.